University of the Philippines Manila College of Nursing is a premier educational institution that shapes nursing education, practice, research, and health and development in the Philippines and in the Western Pacific region. It aims to educate students and train professional nurses and other healthcare providers who will render relevant and culturally sensitive care to all people. UP College of Nursing is the first university-based nursing school in the Philippines. It was conceived through a thesis entitled A University School of Nursing in the University of the Philippines, authored by Ms. Jolita V. Sotejo. On April 9, 1948, the University of the Philippines College of Nursing was established, with Ms. Sotejo herself as the first dean. They were housed in the PGH nurses' homes before transferring to Diliman, and the Quonset huts vacated by the U.S. Army. In 1950, UPCN moved to the second floor of the College of Education building. 4 years later, it moved to the first floor of the College of Law building, called Malcolm Hall, and stayed there for 31 years. In 1977, the Health Sciences Center was created, making it an autonomous unit of the UP system. In view of its renewed organizational structure, the College of Nursing joined the rest of the health professions in Manila, where it rightfully belongs. In 1979, the Philippine General Hospital School of Nursing and the UPCN was merged through Executive Order 545, signed by then-President Marcos. In the morning of April 7, 1997, a fire struck the UPCN on the third floor of the UP Manila building. UPCN transferred temporarily to PGH Nurses' Home, while the new building at Pedro Hill Street was being ready for occupancy. In the same year, the old Bureau of Science building was assigned to UPCN, which was then later named Sotejo Hall, in honor of its founder and first dean. In 2018, a major renovation of the ground floor of UPCN was done. The UPCN lobby was modernized and now facing Pedro Hill Street, where its signage is more visible. The nursing clinics were renovated and its facilities upgraded to have toilet facilities in each room and ramp for patients. The office of the college secretary was moved to be more accessible to students, and now with its own meeting room for academic advising. The computer laboratory was also moved, and its computer facilities to be upgraded. The library was renovated to have more open space and light. The nursing auditorium was modernized for better seating and acoustics. The alumni office was redesigned to be bigger. UPCN also had retiling of all its floors and upgrading of its toilets. A new elevator will also soon be installed. The modernization of the building was through a 30 million pesos grant from the university through Chancellor Carmencita Padilla. Since its inception in 1948, UPCN has had 13 deans who have all given the best years of their lives to the college and the university, and continue to be inspiration and role models of the alumni and students who make the university proud of their accomplishments and contributions to the country and the nursing profession. Since its establishment in 1948, the UPCN is the only nursing school that has maintained a 100% board passing rate through the years, garnering a number of spots in the top 10. UPCN has produced and will continue to produce top-notch nurse leaders in the fields of nursing education, practice, research, and health development in the Philippines. The following alumni have given invaluable contribution to the nursing profession. UP College of Nursing still carries out its mission with the overall objective of providing leadership and excellence in nursing education, research, continuing education, community service, and nursing development. UP College of Nursing promotes leadership and excellence in nursing education to prepare professional nurses who can function as primary care providers in all settings and become socially conscious and responsive to the needs of the country. The academic programs of UPCN include the Bachelor of Science in Nursing, Master of Arts in Nursing, and PhD in Nursing. UPCN is transitioning its curriculum from competency-based to outcome-based education to prepare for global and national trends. This involved the institution of separate courses on geriatric nursing, disaster nursing, informatics, bioethics, and health assessment. Moreover, the Commission on Higher Education has identified the University of the Philippines, Manila as a Center of Excellence for Bachelor of Science in Nursing from 2009 to 2012, and again from 2016 to 2018 in recognition of the college as one of the nursing education institutions that initiate and lead in upgrading the quality of nursing education and training in the country. The UP College of Nursing, in partnership with the Professional Regulatory Board of Nursing, is involved in the development of National Nursing Core Competency Standards, which aims to make nursing education and practice more locally relevant and internationally competitive. In an effort to mainstream the core competency standards, the College of Nursing conducts workshops nationwide for the embedding and spreading of the core competency standards. The first site in Visayas was done last February 2019. Upcoming sites will be in Northern Luzon, Bicol Region, in Mindanao, and the National Capital Region. UPCN continues its strong ties with the Philippine General Hospital Department of Nursing Services, modeling the functional integration between academe and practice. PGH serves as the base hospital and training grounds for the undergraduate and postgraduate nursing programs. UPCN helps in the capacity building of staff nurses in specific topics such as patient safety, evidence-based nursing, and clinical preceptorship. Future project includes the operation of the nursing clinics in collaboration with PGH Outpatient Department. As a trailblazer in nursing research, UPCN with UPM Research Ethics Board conducts the Good Clinical Practice and Health Research Ethics as part of UPCN's efforts to promote ethical nursing researches in the country. Additionally, the UPCN Research Forum is regularly conducted to strengthen evidence-based nursing through dissemination and utilization of significant research findings. Some of the UPCN researches that created a significant impact in the nursing profession include the RN Heals project, which paved the way for the creation of the Nurse Deployment Program in 2014. UPCN collaborated with Yonsei University to study the advanced practice roles of nurses in the Western Pacific region. It also collaborated with Southeast and East Asian Nursing Education and Research Network in determining the needs for capacity building in primary healthcare in the ASEAN countries, and China, Japan, and South Korea. In 2017, the college conducted a commissioned research that determined the skill mix of health workers in primary care settings in the country. The results may inform rational distribution of health workers in the country, ensuring that adequate health workers are working in geographically isolated and disadvantaged areas. Faculty members were also involved in the research work at the Philippine Nurses Association on nurses' work environment in 2015, nurses' salary in 2017, and nurses' workforce issues in 2018. Aside from these, the faculty continue to undertake scholarly work along the lines of their clinical specialization and research interests. The continuing education and community extension services of the UP College of Nursing aims to design and implement continuing education programs for nurse practitioners, educators, administrators, and researchers in cooperation with other institutions and organizations. One of the flagship programs of the college is its International Study Program in Nursing. This program, built on international cooperation and collaboration, aims to highlight excellence in nursing education in the Philippines as foreign-based nursing education institutions send their students for short-term immersion in community health nursing. Some of the regular participants in the International Study Program are students from Seton Hall University, Soka University, Tokyo University, Nagoya University, and Gunma University. UPCN also provides continuing education for faculty development. This area focuses on the work of faculty members serving in the capacity of resource persons or consultants within or outside the university. Being a center of excellence of the Commission on Higher Education, it provides support to other colleges and schools of nursing in the National Capital Region and in the Autonomous Region of Muslim Mindanao. UPCN's work goes beyond the Philippines. It has been designated as World Health Organization Collaborating Center for Nursing Development and Primary Healthcare on 1989, and WHO CC for Leadership in Nursing Development from 2004 to 2008, and redesignated on 2016. UPCN is the first and only WHO CC in nursing in the country, and the first in the Western Pacific region. As the WHO Collaborating Center, the college actively assists in providing technical support to WHO, particularly in nursing development. The college conducted a workforce mapping exercise covering the Philippines, Mongolia, Vietnam, Laos PDR, and Cambodia in 2004. It developed and implemented a bridging program for Cambodian nurses, upgrading its associate in nursing degree to a baccalaureate degree in nursing from 2012 to 2014. Currently, the college is developing a master's degree in public health nursing, which will be offered internationally through blended learning to support the roles of nurses in universal health coverage. This will be offered first in Cambodia, in partnership with the University of Health Sciences to further the work in the bridging program. In its new terms of reference with the WHO, UPCN is also working on a survey and capacity building for interprofessional education in the region. A case studies book featuring the contribution of nurses and midwives in the prevention and control of non-communicable diseases in the Western Pacific is also in the works. UPCN is also working on some projects with WHO, such as developing a training program for the NCD Education Manual and additional materials for the Urbani School Health Kit. The UP College of Nursing continues its strong ties to international nursing groups. It is an active member of the Asia-Pacific Emergency and Disaster Nursing Network, the Southeast and East Asian Nursing Education and Research Network, and the Global Network of WHO Collaborating Centers in Nursing and Midwifery. UP College of Nursing is the legacy of Dean Julita V. Sotero. The honor and excellence brought by every alumni is rooted in the UP College of Nursing's guiding principle of Manus, Caput, Cor. For 7 decades, the UP College of Nursing has remained steadfast and resilient. Today, its core values continue to shine in the hearts of its students and alumni. Integrity, nationalism, caring, excellence, leadership, and love for learning.